Hi, and welcome to a brand new YouTube video called The Kissing Diseases. Say what? You can get diseases from kissing? Yes, it's true. So, in this short video, I'm going to tell you how we can help reduce your risk of getting these diseases. My name is Dr. Take It Easy, aka Dr. Rishi Shompal, and join me as we explore how to reduce our risks. So, say what? Kissing diseases? Yes, kissing diseases. So this wonderful act we all enjoy doing. See that red little circle? An intimate 10-second kiss can transfer over 80 million bacteria. 80 million. That's a huge amount. And there are quite a few diseases one can get actually. Glandular fever, mononucleosis, which we're going to get into, cold sores, warts, respiratory viruses, flus, influenza, tooth decay, and gum disease. So yes, this wonderful act, the kissing that everyone enjoys doing, is often known as kissing disease, one of them which we just spoke about. And kissing is one of the most common ways of transferring many diseases, such as mono, also known as infectious mononucleosis. And in the next slide, we're going to check out the symptoms, about 8 of them, see if you're suffering from infectious mononucleosis. So the signs and symptoms of infectious mononucleosis. Mononucleosis, or mono, is a viral infection that can cause flu-like symptoms that usually show up 4 to 6 weeks after you get it. And there are specific symptoms which one gets. If you tend to get it in childhood, then the symptoms aren't so severe. However, if you do have infectious mononucleosis, then symptoms can include severe fatigue, fever, swollen lymph nodes in the armpits and neck, a sore throat that doesn't get better after treatment with antibiotics, swollen tonsils, skin rash, soft swollen spleen, and a headache. So infectious mononucleosis. 95% of people are infected at some point in their lives. It spreads remarkably easily via saliva or other bodily fluids. Although many people carry this disease without apparent effects, some will experience moderate to debilitating symptoms that can make life-changing issues. Although there are a number of viruses in play when you kiss, the most prominent one is Epstein-Barr virus, which is transmitted via saliva, hence why we're talking about it. Well, the Epstein-Barr virus is part of the herpes virus family. It is the human herpes virus 4. Remember I mentioned that there's other things you can get, such as herpes? Well, the same viral family also causes herpes, shingles, and chickenpox. Fortunately, if you get Epstein-Barr virus EBV as an infant or young child, you typically don't get very sick and probably won't remember experiencing any infection. Mononucleosis, the kissing disease, is the manifestation of EBV that most people recognize. So here's a wonderful mouth, except in this mouth is, oh yes, kissing disease. Look at those nice enlarged red swollen tonsils. Well, they're not nice, but it's something to be aware of. So the possible complications. A recent study in the Nature Genetics revealed that not only does EBV cause mono, but it also contributes to at least 7 other serious illnesses that affect up to 10 million people in the United States. It's important to state that I'm not saying that this is directly the reason why people get these diseases, but they are found to have these diseases as well. SLE, MS, multiple sclerosis, rheumatoid arthritis, juvenile idiopathic arthritis, inflammatory bowel disease, which is essentially Crohn's and ulcerative colitis, celiac disease, and type 1 diabetes. Another possible complication are autoimmune diseases. Research has shown high viral loads of EBV in a majority of patients with a wide range of autoimmune diseases. Autoimmune diseases essentially is where the body attacks its own cells. You've got Sjögren's syndrome, again rheumatoid arthritis, SLE, autoimmune liver disease, autoimmune thyroiditis. Again, there is strong evidence showing a link between EBV and these autoimmune diseases, but it's not enough to suggest that EBV alone is the absolute cause, seen with the previous slide. Finally, the possibilities of EBV in cancer. EBV does show to have an increased risk of getting nasopharyngeal cancer. That's a cancer in the area of the back of the nose. It also increases the risk of certain types of fast-growing lymphomas, such as Burkitt's lymphoma. Lymphomas are essentially blood cancers. It may also be linked to Hodgkin's lymphoma, as well as in some cases, stomach cancer. What are the investigations and treatment? Well, generally, investigations are a monospot test and an EBV test. These are both blood tests, but they're not recommended because in most cases it is self-limiting and it lasts for about 2 to 4 weeks. So the main thing, if you have it, is to be reassured and to remember that fatigue is common with this illness. Occasionally, the disease course can be prolonged, lasting for weeks or months. We tend to advise having paracetamol or ibuprofen, and we encourage people to go back to as normal activity as possible, as soon as possible. And you don't need to be away from work or school. However, it is important to limit the spread of the disease, so avoid kissing and by not sharing eating utensils. Remember though, it's not all doom and gloom. Look at this wonderful picture of this couple. They look very in love. They're kissing. Doesn't mean you have to stop kissing at all. And we're definitely not suggesting that you do this. That's right. I'm not suggesting everyone wears a mask. In fact, I don't wear a mask either. Am I saying to give up kissing? Well, I don't think I'm suggesting giving up kissing. There are actually valuable health benefits to passionate kissing, including a stress reduction. Kissing your partner, either tenderly or passionately, releases calming brain chemicals, neurotransmitters that reduce stress levels and soothe the mind. There's emotional bonding. Kissing your partner is a fun, pleasurable, and important part of physical intimacy and helps maintain a sense of togetherness and love. It also provides metabolic boosts. Kissing burns kilojoules. The more passionate the kiss, the greater the metabolic boost. What I'm not suggesting again is that one needs to record this on their MyFitnessPal or their calorie counter, but it does help to reduce some kilocalories and some kilojoules. Healthy amounts. Saliva contains substances that fight bacteria, viruses and fungi. Deep kissing increases the flow of saliva, which helps to keep the mouth, teeth and gums healthy. It also can increase your immunity. Exposure to germs that inhabit your partner's mouth may strengthen your own immune system. What are the lifestyle tips? Number 1, keep minimal partners. Avoid kissing when you or the other person is sick. Avoid kissing anyone on the lips when you or they have an active cold sore, warts or ulcers around the mouth or the lips. Maintain good oral hygiene, so that means brush and floss your teeth well. Cough and sneeze into a hanky if you have a cold, and try not to kiss anyone if they're sick or you. Things to remember. Yes, this wonderful mouth that we all enjoy. Kissing can transmit many germs, including those that cause glandular fever, cold sores and tooth decay. Saliva can transmit various diseases, which means that kissing is a small but significant health risk. It's not all doom and gloom. Research into passionate kissing has uncovered many valuable health benefits. So my advice is, if you're going to kiss, make sure it's passionate. But the main things to remember is that we just want you to be happy before and even after kissing. So thank you so much for listening to this YouTube video. If you have any comments, feedback, I will answer every single one of them. If you would like me to talk about any topics, please let me know down below. And please hit subscribe on the button that you can see. And I will see you in the next YouTube video. And as always, take it easy.